Is drinking raw milk safe like RFK Jr. suggests? Can you reduce a glucose spike if you eat your food in, quote-unquote, the right order? I'm registered dietitian Abby Sharp. I host a nutrition myth-busting podcast called Bite Back with Abby Sharp. And those are just some of the questions I tackle with qualified experts on my show. There is so much food misinformation and disinformation out there, and it can feel impossible to know what's real and what's BS. On Bite Back, my goal is to help listeners create a pleasurable relationship with food, their body, and themselves, which in my opinion is the fundamental secret to good health. Listen to Bite Back wherever you get your podcasts.
We interrupt this program to bring you an important Wayfair message. Wayfair's got style tips for every home. This is Styles McKenzie helping you make those rooms sing. Today's style tip. When it comes to making a statement, treat bold patterns like neutrals. Go wild, like an untamed animal print area rug under a rustic farmhouse table from Wayfair.com. Arr, fierce. This has been your Wayfair style tip to keep those interiors superior.
Wayfair, every style, every home.
Frequency Podcast Network. Stories that matter, podcasts that resonate.
It's being called a preventable crisis. Measles have returned to our communities, and the numbers are growing. The province of Ontario reported close to 80 new cases in the last 2 weeks alone, and it's part of an outbreak that started in the fall. It's also something we haven't seen in several years. Last year, an unvaccinated child died from the virus in Hamilton, Ontario, and cases are on the rise in Canada, including in British Columbia, Manitoba, and Quebec. In the U.S., over 150 measles cases hitting several states this year, the majority being in unvaccinated children in Texas. Sadly, a young life was lost, the first death of an American child from measles in a number of years. So, what's behind the rise, and is there anything that can be done about it? I'm Melanie Ng, and in this episode of The Big Story, we take a look at the virus and how vaccinations play a role in it all. Joining me now is Sabina Vohra-Miller, a doctor of public health candidate and expert in clinical pharmacology and toxicology. Thank you so much for joining.
Thanks for having me, Melanie.
Okay, before we get into the numbers and the issue that we are dealing with right now, let's talk about the virus itself. And I think often when people are talking about it, because we haven't heard so much until recently, it's been downplayed in the media or people feel like it's not a problem. So let's talk a bit about the virus and just how contagious it can be.
Absolutely. So measles is actually a great example of the prevention paradox where, because we haven't seen it in so long, people have forgotten really how dangerous a disease this is. First of all, measles is highly contagious and it is airborne, so it can remain in the air for, over 2 hours after someone contagious has been in the room. The issue really with measles is that it can cause some fairly serious complications, health complications, and especially in children, which is why we're seeing a lot of these death cases are also occurring in the pediatric population. So if you look at actual core numbers, as many as 1 out of every 20 children infected with measles can develop pneumonia. Children can also get things such as brain swelling, which can lead to blindness, deafness, seizures. In extremely rare cases, it also causes this very progressive and fatal neurological disease that actually develops 7 to 10 years after an infection. So even if a person is fully recovered from the illness, this can occur down the road. And let's not forget that 1 to 3 out of every 1,000 children infected with measles will die, as we have seen both in Texas as well as here in Ontario. But the most scary part for me with respect to measles really is immune amnesia. So what this is that measles can cause this prolonged state of immune dysregulation, which then results in a decreased capacity of your own body, your immune system to fight off other pathogens, other infections. And so you end up having this increased morbidity and mortality from other very, seemingly very, I don't want to say they're not dangerous pathogens, but ones that we can generally fight off fairly well. But we end up seeing people who have had measles have a much reduced capacity to fight off other infections. So all in all, I don't want to mince words over here, but measles is a dangerous disease. And in fact, before 1963, when the first measles vaccine was licensed, measles actually killed so many people across the world. I mean, over 3 to 4 million people a year were infected. More than 50,000 hospitalizations occurred and 400 to 500 deaths annually in just the US alone. This is nothing to sneeze at, you know? And all these rumors of people talking or downplaying measles, I feel they just don't remember how things used to be before the vaccine was licensed. In fact, we eliminated measles because of the vaccine. And here we are back in a period where we're seeing outbreak after outbreak.
So let's talk about the vaccination. And I think back to, 9 years ago when my son was born, and it was, you go to the pediatrician, they say you need X, Y, and Z vaccinations. There were no questions asked. And you get that, in Ontario, it'd be that yellow vaccination immunization card, and you keep record and you just say, at this age, they need the extra MMR shot. At this age, this. Now, somewhere along the lines, thinking has changed. Maybe not keeping up with the vaccinations has changed. There seem to be a number of different factors. And I'm going to guess, and correct me if I'm wrong, that the pandemic maybe played a big role in people not keeping up to date with other vaccinations. Can you talk a little bit about what you've seen experience-wise when it comes to that period of time?
So if you look at some of the numbers from Public Health Ontario, they have been tracking uptake of the MMR vaccine across the board over the last few years, and what we're seeing is that the uptake of the MMR vaccine has decreased. Now, I don't know how much of that has to do with just the fact that during the pandemic we were not having these well visits with the doctor, but there's also been changes with respect to how parents are reporting vaccination to the public health units. So I don't think it's as low as some of the reports are currently mentioning it to be. But I do think that uptake has decreased. So, to have herd immunity, you need at least 95% of the population to be vaccinated. That's our wall of immunity that we need. And we've seen, in fact, just before the pandemic, there was a report by the Public Health Agency of Canada that showed across Canada, uptake was around 92%. So it was already dipping a little lower. And unfortunately, the MMR vaccine has seen massive disinformation campaigns for now a really long time from people who the best words I can use for them are bad actors, because they truly, genuinely are. They're doing this, because they have their own conflicts of interests, and they're trying to increase public distrust in the vaccine. And you're seeing a lot of that occur even now in the US. I think that's gained even more steam because of all these changes we're seeing in the political landscape there. And so I do think uptake in general has decreased because of vaccine mis and disinformation, which is truly unfortunate because, this vaccine, it's such an incredibly safe vaccine. Now, of course, nothing is ever 100% safe or 100% effective. But without a doubt, the benefits of this vaccine far, far outweigh any risks. And we are seeing people declining the vaccine because of all of these rumors and disinformation that is being spread.
Let's talk about what's happening in the US, which of course is having a spillover effect in Canada. I think you're probably referring to the new U.S. Health Secretary, Robert F. Kennedy Jr. We saw what happened in Texas. Again, sadly, a young life lost here in an unvaccinated child. The initial response from RFK Jr. with this outbreak was, I think the quote was that it's not unusual, that these outbreaks happen. I'm paraphrasing that part, but he said it's not unusual. And then over the weekend, sort of retracting a little bit and saying, okay, taking to social media platform X and saying, ending the measles outbreak is a top priority for me and my extraordinary team. And all this comes after sowing doubts when it comes to the efficacy of immunization and vaccines in previous years. And that speaks to the mis and disinformation that not just him, but that other people have put out there that has been proven time and time again incorrect. So when someone who sits at a level like that in government is doing a bit of a flip-flop and downplaying some of the seriousness of viruses and diseases, how do you feel when you see that in the headlines?
It makes me very angry because we've known this about him for a very long time. I mean, what happened in Samoa is not something that people in public health have known about what occurred in Samoa for a very long time, right? RFK Jr. was directly resulted in hundreds of children in Samoa dying because of, a vaccine preventable disease because of all the disinformation that he personally caused. But the thing is, it's easy for us to ignore what he did in a country outside of North America because it just does not exist, right? And so if we don't see it in front of our eyes, then we can pretend it did not exist. And that's what he's done. He's basically denied his involvement in any of that. But right now, he does not want to be associated with the case of that one, pediatric patient who died in Texas. And I think that has probably caused him to do a bit of this about turn because this is right under his watch. This is occurring right under his watch, right? And so the things that he said so far have been so wildly inaccurate. He's talking about how measles outbreaks are not unusual. Well, measles was again eliminated in the US in 2000. It was eliminated in Canada in 1998, right? And so, of course, yes, that means outbreaks occur. But in the US, all of US had, I think, around 250 or 260 cases last year. And the year before that, it was like a handful, maybe 50 cases. We've already, are more than halfway through those cases, and it's just beginning of March at this point. So this outbreak is completely, unprecedented in the sense of how fast it is growing. And it's growing in pockets that are extremely under-vaccinated, which means we're going to see even more devastating effects. And frankly, people who are causing this need to be held accountable. There's no other way around it.
When we look at vaccines and vaccine development, there was supposed to be a meeting with RFK and the first CDC meeting that was supposed to happen at the end of February that got postponed. And now it seems that they are, bracing for possible changes when it comes to vaccine policies. How dangerous could this be?
Extremely dangerous. I can tell you every single colleague of mine who works in public health in the US, we have a pretty, well-knit and pretty tight community. We are all losing sleep over this, right? And you're seeing that not only changes are occurring in vaccine policy, but you're seeing people being fired from organizations that are doing critical work. You're seeing people who are working on avian influenza being fired. You're seeing people working on disease outbreak teams that, in fact, would be so helpful and so needed right now in Texas, being let go. You're seeing people working in food safety being fired. So we're seeing this across the board. We're seeing even in the US's international response with USAID, a lot of the work that is being done on Ebola and HIV. I mean, I think it is important to remember, we know this from COVID, that pathogens don't have passports, right? Boundaries and countries can't keep these things away. So what is happening in the US, will of course affect Americans, but it will equally affect Canadians and it will equally affect people around the world. And so we're at this point where I feel we're at this crux that we're probably going to be seeing a lot more vaccine hesitancy, changes in vaccine policy, and that will most likely end up in causing all of these, diseases that, for the most part, we were able to at least, if not eliminate, at least decrease the, the likelihood of it, the exposure of it significantly. But we'll see the comeback of all of these. We will see things like pertussis or whooping cough. We're already seeing outbreaks of that occur. My biggest fear is we're going to see things like polio, come back again with the huge reinsurgence. And then again, this is a time when we really need to be focusing so much on mitigation and preparedness for avian influenza, and none of that work is really being done in the US right now. And again, this is going to have huge impacts on the entire world. So, I mean, I don't know. I'm trying not to be alarmist about these things, but this is keeping me awake. I won't lie. It is really stressing me out. And I know it's stressing a lot of public health people, both in US and Canada right now.
Well, I think for a lot of people, it's, as you say, sometimes it's the louder voices that are getting the attention, or the mis or disinformation, and those who have done the work, have done the studies, have researched this for several years, and we've seen again, like you said, a decrease in numbers, if not completely eradicated. It seems for several viruses and diseases, for it to go backward, who needs to be the louder voice? Like for the average person, when they are watching the headlines, it seems like during the pandemic there was some sort of tune-out factor, and that's unfortunate. Whether or not they agreed to it, they didn't want to hear it. And are you concerned that that's going to be the case, or that is what you're seeing right now, the tune-out factor? Not even just the mis and disinformation; it's that I don't want the information.
I think there's definitely going to be a pocket, a subpopulation of people who just don't want to hear any information, because I can understand like topics like this are anxiety inducing. I mean, I can tell you from a perspective of a parent myself, right? I remember taking my own child for vaccinations and remember thinking, at his 2-month visit, like, am I doing the right thing? And I know in the bottom of my, bottom of my heart, my mind, everything, I knew that this was exactly the right thing I need to do for my child. But the issue is that some of these messages are so pervasive, and they find a way to seep their way through your conscious, and you don't even realize that you're subconsciously anxious about something of this sort. Which is why, honestly, my heart goes to the parent of the children, of the 2 children who've died because of measles, the one in Texas and the one in Ontario, because they just fell for this disinformation spread by people. And by the way, RFK Jr. himself is vaccinated and his kids are vaccinated. So, so he's clearly not following what he's preaching. So they're protecting their own children, but they're spreading this information that is then impacting the children of others, right? And that's the part that really, really upsets me, because we've all been there as parents where we're unsure about what we're doing, whether we're making the right call or not. But there is just now there's intentionally so much fueling of distrust that people are now afraid of everything, including things like Girl Scout cookies, and so we're creating this fear mongering atmosphere where we're actually taking attention away from the things that really impacts people's health and well-being, instead putting it on these things. And now people don't understand how to discern between what is credible, what is not credible. Everything is so murky, and then that's going to end up causing people to make these downstream decisions where they're not eating their Girl Scout cookies, they're avoiding red Skittles, but they're also avoiding vaccinations, right? And the whole thing just does not make sense right now, because there's just too much cognitive dissonance and too much murkiness of information right now. And that's exactly the point. The point here is to actually feel distrust in health institutions, in things that we know that are working, because they don't want to address the things that is really impactful. So things like underfunding, things like health access, the things that would actually make a difference to people's health, they don't want to tackle that. And instead, they're causing all of this distrust in everything under the sun. And people, like the average parent, is now confused about what to do and what not to do.
And some of that murkiness, Sabina, is coming in the form of, where are people getting their information? And is it on social media? I was reading this, it was coming from the States, where people were doing measles parties again, like, the chicken pox parties. And wow, as you described how dangerous measles are and how contagious they are, this is quite possibly the worst idea anyone can possibly do. But because it gains traction, because it's a headline, ooh, I saw it on TikTok, that they go, maybe this is a good idea. Going beyond, I think a lot of people aren't going beyond the headline, and they're finding different sources which become credible to them without realizing the major impact. Are you seeing that?
Very much so. We are hearing a lot of these stories where, in fact, there are families who not just are having, measles parties, but they're also refusing to get treatment and refusing to go to the hospital, refusing care. They're doing a lot of alternative therapies at home as well. And I think a lot of this has to do partially with just romanticizing the past. We're talking about making, America healthy again. It's just, there is this whole fixation that at one point back in the day, things were better. And I just, want to remind people that was actually not the case. Our lifespan has steadily increased over the last few decades for a reason, because modern medicine has allowed us to do this. So the whole romanticization of measles being great, or, going back to a time where whatever it is that they've, romanticized in their head, it just does not make sense. In fact, we're going to a world where there's, less regulation of things. There is more disinformation. And in fact, overall, you're going to see this impact on people and people's lives, and how long people are living, and whether people are living healthy lives. Because modern medicine it's a miracle. And I have to keep reminding this to everyone. If we didn't have modern medicine, if we didn't have public health, we would not be living such long and relatively healthy lives. And in fact, what we need to do is go back and figure out where we lost the plot on things like, okay, how do we encourage people to, for instance, limit processed food, limit sugars, eat a wholesome diet, get exercise, control stress, get proper sleep. These are the things that matter. But there's no money in this, right? There's no money in this. And so instead, people are trying to cause all this disinformation, meanwhile sell supplements that are not tested, and, have all of these alternate therapies in place that are not doing anything great. They're just hurting the population.
Well, let me ask you something really quickly, as my last question here. Is there a connection with, people are looking for information, but many people don't have access, say, to a family doctor. And so which voices are they going to? Is it the voices, the talking heads they see on their TV screens? Is it, then it's TikTok, then it's Instagram, or wherever they can get access to a resource? I'm doing quotes, air quotes here, because it just really depends on who you're reading or who you're hearing. But accessibility to a family doctor, that trusted voice, lack of it happening. I know it's a big problem in Ontario. In fact, it's a big problem in many parts in Canada. Do you think that that's contributing to some of the myths and disinformation?
Absolutely. Access to healthcare is so important. And you're also seeing a lot of this happen in, racialized communities, where there's even less access to good information, less access to health, less access to physicians. But I also have to just say, I've been sort of in this vaccine mis and disinformation world for over a decade now. It didn't start during COVID. It was well past beyond that. And what I've noticed is that I do feel in the healthcare community, we don't take the time to have these open conversations with people who have concerns, right? And so the number of times I've heard people who have, for instance, have had a vaccine reaction get completely dismissed, or do have concerns, are not completely dismissed. And I do think we really need to take the time to talk to them, to understand their concerns, alleviate their fears. And I think that's important, because if we're not doing that, what they're going to do is find other people who are, right? And usually the people who are going to be more empathetic and more sympathetic to them are going to be people who are, let's say, not in it for the right reasons. So, and I'm hesitant to tell people don't get information from social media, get it from, a trusted resource, because right now the trusted resources, for instance, in the US are not exactly trusted resources. But so what I would rather people do is actually critically evaluate information coming their way, right? Whatever information this is. If someone is telling you something about, fear mongering on something, take a step back, look at who is saying this. Do they have credentials? What credentials do they have? What data are they using to back up? Do they have references and citations for what they're trying to say? Why are they saying this? Are they selling something to you, that they want you to buy instead? Like that critical evaluation is a piece that I think really needs to come basically for any information people are exposed to, because we're entering into an era where it's just going to be increasingly difficult to discern what is good and what is bad information. But absolutely, access to healthcare is number one on that priority list. And I think, our situation in Canada, and especially Ontario, is not great, and is definitely contributing to all of this as well.
Well, hopefully conversations like this one can help people make decisions that are right for themselves and their communities. Sabina Vohra-Miller, appreciate you taking the time with us today.
Thank you so much for having me.
And that was The Big Story. You can send us your feedback on this episode or any other episode by emailing us at hello@thebigstorypodcast.ca. You can also find us on the Seeker app or on all your favorite podcast players. Make sure you rate, review, follow, and share. We love to hear it. I'm Melanie Ng. Thank you so much for listening.